everyone. We are now on the 6th section of the Prehospital Pediatric Readiness Assessment Checklist and talking about quality and performance improvement. So the first two items here are that your process improvement process includes pediatric encounters. And the second one is that you have pediatric specific measures that are included within your process improvement process. There are too many P's. I can't keep it straight, but I think those are two different elements on the checklist. So do you want to tackle what is the difference between those two and maybe give an examples to enhance understanding?
Do you want to go first, Doctor?
Go ahead, Chief.
One thing we do that kind of addresses both of those is we pick kind of core quality improvement areas we want to work on. So we introduced 3 bundles of care recently for pediatrics. One dealing with ped seizure, peds bronchospasm, ped shock. So the first one we're doing is seizure. So we look at every ped seizure call we go on in a month. And then, so that's that kind of encounter part. And then we QA compared to the care bundle. So, you know, if the child's SATs are low, did they get O2? Did you manage the airway? Did we check a glucose on every one of these kids that are sick? If they're actively seizing, did they get the appropriate dose of benzodiazepine? So those would be like the specific measures. And then we generate an individual report that goes back to that crew. And then we do monthly summary reports to show the system where we are and where we need to improve. So I think you can hit both with that kind of process. You look at the calls we're going on and look at quality improvement pieces we're going to evaluate against.
Yes, and Mark, Chief Pinchalk does an excellent job in leading this. The other thing for point 1, PI process includes pediatric encounters. We meet monthly. Pittsburgh EMS meets monthly for QI sessions. And in every session, there is a pediatric portion of the meeting where we go over specific cases and we talk about quality improvement and performance improvement for those specific cases. And then to Chief Pitchalk's point, to delve even further, we have pediatric specific care bundles that actually provide measures for certain types of chief complaints or illnesses in pediatrics. So we do both. So we discuss, first of all, we discuss specific cases. So which are our pediatric encounters. Those get discussed every month and addressed with pediatric liaisons, which is myself and Dr. Sircone at the Children's Hospital. And we also have an EMS specialist, a pediatric EMS specialist at our Children's Hospital. And so we go over those during the meeting, but we also, throughout, our daily interactions, will receive emails on specific pediatric encounters on, we don't get a lot of pediatric cases overall, but so we'll get those and we'll address those in real time. And then the ones that we want to delve into further, we'll delve into at our QI meeting. And then secondly, with our pediatric care bundles, we delve into the measurement of the PI process for certain pathologies or certain chief complaints of pediatric patients.
And I think this is a good place to highlight the National EMS Quality Alliance. So NEMSQA has developed national quality metrics for EMS systems that are validated quality metrics. And there are some pediatric specific metrics as well as, like other metrics that children are definitely included in. So I think an example of pediatric specific metrics has in pediatric respiratory distress, how often is an assessment completed? Right, like which is because I have to have an assessment to be able to appropriately treat. So that is one of the metrics. Are you recording pediatric weight in kilograms, especially for children that you're administering medications to? I also think that there's some other metrics that we should be including children in. So one of the new NEMSQA measures is, do you do a 12 lead for syncope? And I think people tend to think that that is like for old people, right? Because they're looking for like adult causes of syncope without thinking actually in children, there are like deadly causes of syncope that you can pick up in an EKG. I can pick up congenital prolonged QT syndrome. I can pick up HOCM. I can pick up all these different cases. So there are some metrics that we shouldn't be excluding children from, like we expect those same care for those pediatric encounters. It's not necessarily a benign cause when an athlete passes out, right? Like I can't attribute it to dehydration until I've thought about some other more significant causes. So, and so the next two items are some pretty sexy data things, which is submission of EMS data to the state's pre-hospital care database, and submitted data is compliant with the current version of NEMSIS 3.5 or higher. So how do you know if your agency is submitting data to the state database and is NEMSIS compliant?
Technology poor, but I rely on our IT specialists. It's state mandated, the version of the electronic charting system we use that meets those NEMSIS requirements. And I'm IT weak, but I rely on people smarter than me to assure me, yeah, our system's good, and that data uploads to the state on a regular basis.
And I think from like a quality standpoint and a research standpoint, I think that's pretty, not pretty, that's really, really important. And the other thing is agencies can actually have like agency access to, like there can be regional access to NEMSIS to look to regionally, how are you performing? So whether or not you are somebody who has like regional oversight or agency oversight, you have ways to go in and ask, how am I performing? And the NEMSCO measures are already programmed you can through NEMSIS, so you can actually pull the NEMSCO measure. So you can, even if you're like, I haven't looked at something pediatric at all, like some of that stuff, just like start somewhere and see how you're doing. So the last, I think might be a little bit more challenging, which is a process to track pediatric patient-centered outcomes across the continuum of care, such as but not limited to transport destination, secondary transport destination, ED and hospital disposition, ED and hospital diagnosis, survival to hospital admission, and survival to discharge. So can you give me an example of a system that is able to track pediatric outcomes in that way?
I'd say it's an area we struggle with a little bit with all of our programs. You think in the era of big data, there should be an easy solution to this. It's all electronic medical records, and when we take someone to the hospital, we should be able to get automatic feedback, or be able to access, hey, what was the ED diagnosis? What was the disposition? Did they go to ICU? Did they survive to discharge? That kind of stuff. There's no system currently locally that does that. We're thankful that our physicians and our pre-hospital specialists at the hospitals work with us to get us those outcomes. But we're sending individual queries via email, and it takes some time to get processed on the other end and come back. So, that's an area that it's a slow process, and you really can't get big outcomes. It's more individual cases or specific patient sets, such as seizure. So I would like to see in the future, with everything being electronic and bigger data sets, a system built through all these NEMSIS compliant ePCRs. Hey, we take a patient to Children's Hospital, it automatically spits back, hey, this was patient's disposition, diagnosed with this, and admitted discharge, survived to just. So I think that's a gap that we experience currently.
I think the importance here is to, like many of the things on the checklist, if you don't have this in place, to begin to think about it and begin to think about how you can put those processes into place. I think it also recognizes the importance of systems of care, which I believe will be the next module, and having collaborations and relationships with your local hospitals. To Chief Pinchalk's point, because there's a relationship there, there's a liaison that will be able to get the information that you need. If there's no relationship between the EMS system within the jurisdiction, and particularly in those healthcare facilities that take care of children, of which majority of children go to community ED-based centers. About 80 to 90% of the children throughout the country go to community-based ED centers and not pediatric tertiary care centers. And so to have that relationship and collaboration with your local healthcare system and have the discussion around, hey, at some point we would really like to track our pediatric specific outcomes. How can you help us to do this? How can we better collaborate to get this data and get this information? I think here, emphasis is to get that conversation started because I imagine many EMS agencies throughout many jurisdictions don't have the resources like Chief Pinchalk is talking about. There are some places, such as San Diego, that has very advanced systems of linkage, you know, for those who do research, to have direct linkage between EMS systems and the hospital care system. But for the majority of us, we don't have that linkage, or you have to create that linkage through help with experts in research and IT and things of that sort. But I think the importance here is to just begin to think about these things and begin to track these outcomes and begin to think about how you're going to work with your local healthcare institution to do that.
Yeah, and there, right, like there's examples of, you know, the health data information exchanges that are well established in some places. And I think that's exactly right. It's like, even if we have this just for one condition, if I have this for cardiac arrest through CARES, if I have this relationship with a pediatric trauma center to track those outcomes, but then thinking about how do I build a system and saying that this is not like an optional thing. This is the goal, right? Like these are our patients, and to do performance improvement, I need to like understand the outcomes of my patients. So quality improvement is like my favorite subject. So I'm super excited we got to talk about it. And I think in summary, are you tracking your pediatric encounters, right? Like, and if you haven't started doing that, just like start with the NEMSQA measures, or something similar, and just say, you know, how are we doing on something that is deemed important? Make sure that, you know, check in with your IT folks or your state about what is the data that we're collecting at a regional or a state or a national level, so that we can continue to advance pediatric care. And the last is, I think this is pediatrics, but all of medicine. How do we continue to advocate for our role in the continuum of care? So like access to the outcomes for our patients.